Thank you very much, Johanna, for the introduction, and also a warm welcome from my side to our call to webinar. My name is Petra Ritter. I'm the coordinator of the European Testing Experimentation Facility for Health, AI and Robotics. And in the next 15 minutes, I give you an introduction to TEF-Health and our recently published open call. Europe has the goal to become a leader in trustworthy AI. And it is the first region worldwide that introduced a regulation for trustworthy AI. The AI Act came in force in August 2024, last year. The AI Act defines 4 risk classes. Medical devices that contain AI systems are classified as high risk. And high-risk AI systems need to undergo conformity assessment before entering the market. So what is now an AI system? According to the definition of the AI Act, it is a machine-based system designed to operate with varying levels of autonomy and that may exhibit adaptiveness after deployment, and that for explicit or implicit objectives infers from the input it receives how to generate outputs such as predictions, content, recommendations, or decisions that can influence physical or virtual environments. So an AI system doesn't need to be adaptive, and it also doesn't need to be autonomous. It's a very wide definition. Medical devices that contain AI systems, according to this definition, need to undergo conformity assessment with respect to the requirements of the AI Act. Here we see the timeline of the AI Act. We presently have a grace period for high-risk AI systems, and this grace period ends in August 2026. By then, all products need to have undergone conformity assessment before going to the market. High-risk AI systems need to fulfill certain requirements that are listed here. It is required to establish a risk management system, data governance, technical documentation, record keeping, transparency, and information provision to users, human oversight, accuracy, robustness, and cyber security. And there are also requirements for the different actors. For example, for providers, they need to meet the requirements by receiving a declaration of conformity, disclose name and trademark via registration, establish a quality management system with fulfilling accessibility requirements, and going with their product through conformity assessment, and document the fundamental rights impact assessment. Here on the right side, you see other obligations related to general purpose AI modeling systems. The fundamental rights impact assessment, according to the AI Act, comprises the documentation of compliance with respect to human agency and oversight, technical robustness and safety, privacy and data governance, transparency, diversity, non-discrimination and fairness, societal and environmental well-being, and accountability. The AI Act defines the role of TEFs as follows. Testing experimentation facilities. TEFs are an implementation instrument of the AI Act, and they provide technical and scientific support for providers and notified bodies. In 2023, the European Commission established 4 TEFs, one of which is TEF-Health. The others are in the sectors agriculture, manufacturing, and smart cities. TEF-Health, the Testing Experimentation Facility for Health, AI, and Robotics, comprises 52 partner organizations in 9 countries and is funded with 60 million euros funding, half coming from the European Commission and the other half from the member states. Here you see the participating member states. Germany is in the lead of the consortium, and other member states are Belgium, France, Italy, Portugal, Slovakia, Sweden, Czechia, and Finland. Our 52 partners are half private, half public. They provide a wide range of support to SMEs. And we celebrated the opening for business of TEF-Health in March last year, together with the other 3 TEFs in agriculture, manufacturing, and smart cities. Our next large public event will be also together with the other 3 TEFs, held in Milano in October this year, 2025. TEF-Health provides a wide range of services, ranging from access to testing facilities and infrastructure to access to data and a variety of consulting services via a single entry point, tefhealth.eu. Via this URL, you will find our website, and the resources and services can be accessed all via this single entry point. We have presently listed in our database, the so-called knowledge graph that is also accessible via the website, more than 300 services from several member states. And they are also provided cross member state borders and can be discovered via this knowledge graph tool. Our services range from providing access to data, to infrastructure and consulting services. So for example, our customers or users can access sensitive health data from various hospitals in compliance with GDPR and other applicable regulations. They get access to testing facilities, also to simulated environments, but also to real-world environments where they can test their AI systems and workflows, and also receive consulting services. This also includes support for clinical trial studies in real environments, such as hospitals with access to patients and physicians. As mentioned previously, on April 1st, we have published our second open call for services that come at discounted prices. We now have opened 2 calls that can be discovered via our website. And there you also find all the detailed conditions. There's an info sheet containing all the relevant information. So there's also a summary, what is TEF-Health, what kind of services are being offered through this open call at discounted prices, and most importantly, who can apply. SMEs can apply that are established in the European Union or the European Economic Area with AI or robotics innovations with a technology readiness level of 6 or higher, that have not received a state aid within 3 years that exceeds 300,000 euros. Via this info sheet, you will also find the links to detailed documentation for the application portal, the application guide, and of course, you will also get access to the circa 200 services that are provided at discounted prices. The call 2 will stay open for the time being, either until the capacity is reached by our service providers or until the end of the project, which is on December 31st, 2027. We will have also additional webinars in the future that will be announced on our website, and Johanna also will provide more information about the webinar series that is planned at the end of this webinar. You find more resources. If you, for example, click the buttons under the info sheet, you will get access to a guidebook, to a documentation of this call too, but also access to the online documentation for applicants. If nevertheless there are still open questions, you have the possibility via the TEF-Health platform to use the help desk functionality and submit any open questions via the help desk. And as also mentioned already by Johanna, at the end of this webinar, there will be a Q&A session where you also have the opportunity to ask your questions. For now, I say thank you and will hand over to the next speaker.